All right. Hi, everyone. My name is Wendy Castle with One Bite Nutrition. Super excited to have Nikki Bomar with us going over some tips about hydration and how to stay hydrated. So, Nikki, with summer coming, how do you know if you're hydrated enough?
Yeah, so my favorite stat is that 47% of Americans are chronically dehydrated. That's almost half of us. When you take into consideration the fact that at least half of our bodies, up to 70% of our bodies, depending on how old we are, is made of water, it really shows just how important it is to get enough water throughout the day.
Yeah, absolutely. One of the essential nutrients that we don't talk as much about, vitamins, minerals, carbs, fats, proteins, we talk about those all day, but hydration, I think sometimes is just assumed. So that's definitely something that I talk about with my patients quite a bit. So, what factors influence hydration needs?
There are so many factors to consider. Height, weight, activity level, if you live in a warmer climate, and then of course your health status as well. The more you sweat through exercise or work, or just simply it's really hot outside, and even if I'm not doing anything, I'm still sweating. All of these are going to increase those needs, and it doesn't necessarily need that you need a rehydration drink like a Gatorade or Powerade. So I always encourage my patients to ask me about those things, or whoever your dietitian is, about if I need an extra supplement like a rehydration drink, and if and when I may need a product like that.
Yeah, absolutely. And if somebody's trying to make a hydration goal, what are some general guidelines on how much they should have?
The minimum I suggest is 64 ounces. That comes out to 8 food cups throughout the day. So unless you have a condition with like a fluid restriction, then we're going to need to, that's going to be different needs than what we discussed today. But on average, again, 8 cups for that minimum. On average, the woman needs 12 cups of water and men need 15 cups of water a day. And that can come from different sources too, but getting more. And then just that 8 cups, but minimum 8 cups.
Yeah, absolutely. And I love that you said it doesn't all have to come from water because liquid foods, soup, stuff like that, anything that contains that liquid will count towards some of that. What are some signs of dehydration if somebody thinks that they might be dehydrated?
So it can definitely happen on varying levels, right? To mild dehydration to severe. The key signs are weakness, dizziness, headaches, dark urine, dry skin. Your skin and urine can actually be the biggest signs to watch out for on that mild side of dehydration. Your urine should be the color of a yellow sticky note, and the like pale yellow ones, not the super neon yellow ones. And if your skin is always dry despite the use of lotion, and it's not the middle of winter, then you're likely a bit dehydrated.
Yeah. And are certain people more at risk than others, maybe?
Yes, so the elderly is going to be the highest age group at risk of dehydration, and also those who live at higher altitudes, really warm climates, especially warm and dry climates. And of course, if you have a physically demanding job or one that requires you to be outside in the heat for hours, you also have that risk of dehydration. So it's important to check with yourself throughout the day to track how much water have I drank. It's easy to get caught up in, kind of forget to do it.
Yeah, absolutely. Well, on the flip side, so I know like 50% of the American population is not hydrated enough. What about overhydration? Is that is too much possible? Like, is that a possibility?
Yeah, and this is something that patients can be worried about too, especially when you're not used to drinking water and then you're trying to drink, our goal for water, it feels like a lot of water. However, overhydration is really rare, but it can happen. And the symptoms are really similar to dehydration, actually, with the weakness and the headaches. The group most at risk for overhydration is going to be athletes. And I know we don't usually come on here and talk about pee so much, but watching your urine color can help you detect this as well. So if it's always clear and it's been a while since we've gone, we may want to cut back or spread it out. Now, if you just chugged, a whole 24 ounces of water, okay, you're probably gonna have to pee pretty soon and it's probably gonna be pretty clear. So spreading that out throughout the day as well as having enough are both important.
Yeah, absolutely. So what are some things that people can drink when they're trying to increase their fluid intake?
Yeah, so I know you said earlier, right? Our soups and like fruits and veggies, they all contain a little bit of water too. And when I look at like a fluid goal with a patient, I don't always say, only plain water counts for this. So things like flavored water or fruit infused water, again, fruits, veggies, popsicles, soups. These are just a few ways to get it in without thinking about, again, physically drinking just plain water. And some people don't like plain water, and that's okay. I would just encourage them to try like the flavored water and the fruit infused varieties are gonna be good ways to start getting more hydration in.
Yeah, absolutely. I started putting a pitcher of water on our counter and I put some sliced lemons and limes on there. And it's crazy how much the boys will go down there and drink because one, they see it and it's a reminder, and two, it's got just a little bit of flavor, and it's not just plain water. So just some
My
tips.
favorite is strawberries and basil to put in my water.
Oh, yeah, I've had that before. That is really good.
Mhm. Again, just enough to, it doesn't feel like I'm drinking plain water, but can still increase your intake.
Yeah, absolutely. It's safe to say that most people have some room for improvement in regards to their hydration status. Hopefully, the tips we covered today will help you out with that. We do have a blog dropping in regards to hydration, so check out our website if you want some more tips. And if you want to see a dietitian, check out onebitenutrition.com and you're able to book direct from there. Talk to you later.